Hello everyone, welcome back to our channel. This is Guntur Medical College, Department of Anatomy. In this video, we will see the dissection of the anterior abdominal wall. Abdomen is bounded above by the diaphragm and below by the pelvic diaphragm. So this abdomen consists of anterior abdominal wall and posterior abdominal. What you are seeing here is the anterior abdominal wall, and in the anterior abdominal wall the umbilicus is situated. It is a scar formed by the umbilical cord, and it is approximately at the level of the disc between L2 to L3. But it is not a constant, its place is slightly variable. So if you see the anterior abdominal wall, it consists of skin. So you are seeing this is the skin of the anterior abdominal wall. So the anterior abdominal wall is musculofibrous compared to the posterior abdominal wall, which is made of osseomusculofibrous. In the middle of the posterior abdominal wall, we have the lumbar vertebra, but if you see in the anterior abdominal wall, it is made of full of muscle and fibers. For extension of the so many systems inside the abdomen, it is we have this anterior abdominal wall made of muscle and fibrous tissue. Skin, the skin, we have given the incision in the upper part extending along the costal margin, and we have given incision in the midline extending to the pubic symphysis, and we have reflected the skin laterally, and after the skin is reflected, the anterior abdominal wall is made of a superficial fatty layer, but in this cadaver, because it is very thin, we have the limited superficial fatty layer, and the superficial fatty layer is single layer in the upper part. If you see from this line extending from this anterior superior iliac spine, if you see below that level, it will be made of two layers, campus fascia and scarpa's fascia. Campus fascia is the superficial fatty layer, and deep membranous layers is the scarpa's fascia. But in this cadaver, we are not able to see the superficial fatty layer very clearly, as it is very much less, and the deep fascia is said to be absent in the anterior abdominal wall for the easy distension of the abdominal contents. Then if you see after this superficial fatty layer, we have the abdominal wall muscles. We have three muscles. One is oblique external and another is oblique internal. If you cut along this internal, another one more muscle is the transverse abdominis, which is having the transverse running of the fibers. First we will see this external oblique muscle. In this dissection we will see the external oblique and internal oblique. If you see this external oblique taking origin from the ribs, here the rib cage is cut to dissect the thorax. So if you see this origin, it takes origin from the lower border of the lower 8 ribs. So this is the fleshy origin from the ribs. If you see the insertion of this external oblique, this is the fleshy fibers going for insertion into this anterior lip of the ventral segment of the iliac crest. So that is the one attachment along the iliac crest. If you see the next insertion, one more is this. This is forming one aponeurosis along the costal margin. If you see, this aponeurosis is typically said to be F-shaped. So if you see here, this is the typical F-shaped aponeurosis of the external oblique muscle. This aponeurosis of the external oblique muscle is folded along its lower margin to form the inguinal ligament. So this is the inguinal ligament. So this ligament, are you able to see? This is the inguinal ligament, which is formed by the folded lower part of the aponeurosis of external oblique. One more, in this lower part of the aponeurosis of external oblique, we have a deficiency this is called as the superficial inguinal ring. So through which spermatic cord passes in the male and round ligament of the uterus passes in the female. If you see these attachments of the superficial inguinal ring, it has, this is one crura and this is the another crura. This is attached to the pubic symphysis and this is attached to the pubic tubercle. So the superficial inguinal ring is just above the pubic crust. So this is the superficial inguinal ring which contains the spermatic cord in the males. If you see the remaining aponeurosis of this external oblique, apart from its modification, if you see, this is the rectus abdominis muscle. So this aponeurosis passes in front of the rectus abdominis muscle to form this linea alba, that is the, you can see in the middle, that is formed by all the anterior abdominal wall muscle that is extending from the symphysis sternum to the pubic symphysis. So that is attached to the linea alba. This, if you see the direction of the external oblique muscles, it runs downwards, forwards and medially. So that is about the external oblique muscle. The next muscle, if you see, so this is the internal oblique muscle. It runs upwards, forwards and medially. How to remember this origin is, first we have to remember this external oblique taking origin from ribs forms one inguinal ligament. From this inguinal ligament, the remaining two muscles take origin. If you see this internal oblique, it takes origin from the inguinal ligament and also from the iliac crust, middle lip of the ventral segment of the iliac crust. Then if you see this insertion of this internal oblique muscle on the lateral border of the rectus abdominis muscle, or you see this is rectus abdominal muscle. This border will be called, if you see here, this will be called as the linea semilunaris. Midline is the linea alba and this lateral border of rectus abdominis is the linea semilunaris. This internal oblique aponeurosis, on reaching the rectus abdominis, it splits into two layers like this. It splits into two layers. One layer is anterior layer fusing with the anterior wall of rectus sheath. Another layer is fusing with the posterior wall to form the posterior wall of the rectus sheath. So that is again inserted to the linea alba. So this rectus sheath formation is mainly by the splitting of the aponeurosis of internal oblique muscle at the lateral border of the rectus abdominis muscle. So that is about the two muscles we have seen, external oblique, and in this another muscle we have seen is the internal oblique muscle. The remaining muscles, transverse abdominis and the rectus sheath total contents, we will see in the next video. Thank you.